What kind of care do you want today? That's the question you'll be asked when you enter the Center for Hospice Care. Discover your choices, learn what the experts can do for you, and plan ahead. Choices to help you make the most of your life. And we're going to share this beautiful campus with you right now. Taking a few minutes out of his day is Mark Murray, who is the President and Chief Executive Officer for Center for Hospice Care. Mark, thank you so much for giving us some of your time.
My pleasure.
Let's talk about a little bit of the history of Center for Hospice Care.
We were incorporated in 1978, started serving patients in 1980. Originally just one county. I think we were called Hospice of St. Joseph County, Inc. We began going into other counties, crossing the streets. We care for patients in 8 counties today. And we've cared for over 2,000 patients a year the last 3 years. And all told, it's been over 34,000 patients.
Mark, could you tell us what are some of the things that set Center for Hospice Care apart from other hospices?
Well, there are 32 different hospices in our 8-county service area, but I think the main thing that separates us is experience. We have a deep bench of professional medical staff. We have 3 board-certified hospice and palliative medicine physicians on staff here, and 3 nurse practitioners that are certified in hospice and palliative medicine. We're also proud that we're a not-for-profit. We're a charity. We do give back to the community. We also have a very strong veterans program with our We Honor Veterans. We're a 4-star We Honor Veterans member. And that's a special program where we train volunteers and staff in the special needs of veterans. So we dedicated a Veterans Memorial last fall.
I understand that Center for Hospice Care offers palliative care. How is that different from hospice care?
It's very, very similar because all hospice care is palliative. The word palliative means just to simply treat the symptoms and not attempt to try to cure the underlying disease. But palliative care isn't limited to a 6-month life expectancy. And in our future, we hope to really expand palliative care with a community-based palliative care program. We have right now the Center for Palliative Care, which is one of the only freestanding outpatient clinics here on the Mishawaka campus. So we hope to do a lot more in palliative care and be able to help patients much further upstream from their need to come into hospice care and be able to serve patients the best that we can.
One of the things that I hear from other people when it comes to hospice care, and this is personal experience included, they ask themselves, why did I wait so long?
Hospice care is intended for up to 6 months. About 42% of all of our patients are with us just 7 days or less. And that's not enough time to get all the benefits from hospice care that people are entitled to. People live on average 27 days longer in hospice care than the same people who didn't have hospice care with the same diagnosis. So it's not about giving up. It's often about expanding your horizons, expanding life, living life to the fullest. As someone once said, we can't add days to your life, but we can certainly add life to your days.
Joining us is Mike Wargo, who is the Chief Operating Officer of the Hospice Foundation. Mike, thanks for having us. What is the purpose of the Hospice Foundation?
Hospice Foundation is the supporting foundation for Center for Hospice Care. We provide funding for various initiatives the Center for Hospice Care undertakes. We provide discounted and unreimbursed patient care for those patients that don't have Medicare, Medicaid, or private health insurance. We also provide bereavement support services. We have a number of different group counseling programs that we offer. In addition, we also provide support for a couple of, I'll call them specialty programs in our bereavement area. One's called Camp Evergreen. It's a program we've done for 23 years for grieving children in our community. We also provide a program called the After Images Art Counseling Program, and that program is run by a gentleman named Dave Labram.
We've had an opportunity to walk around your beautiful campus. What are the plans for the future?
We're building 2 new buildings. One is a clinical staff building that'll be connected to the east wing of the building we're in right now. And then the other will actually be a 12-bed inpatient unit, a hospice house, if you will. We have a campaign going on right now. It's called the Crossroads Campaign, and it's a comprehensive fundraising campaign to raise $10 million. and we've had a number of donors who've stepped up. But we're still in the process of trying to raise another couple $1 million. So that's probably our biggest priority right now. Once we can get to that point, then we'll feel comfortable breaking ground. At this point, I'm hopeful we'll be able to break ground in the spring of 2018.
What kind of care do you want for your loved one today? You can find out by calling the Center for Hospice Care. Their number is 1-800-HOSPICE. Find them online at cfhcare.org. Compassion and dignity. You'll find it right here at the Center for Hospice Care.